the pregnancy-induced diabetic mellitus. So indication for subcutaneous insulin aspart is preoperative and postoperative use when patients are eating to control hyperglycemia. Intraoperative use for short procedures for newly diagnosed diabetic mellitus admitted to hospital. Known diabetic on oral drug admitted to hospital in diabetic ketoacidosis. All the indications of insulin can be shared by a newer insulin, aspart insulin or analog insulin. Insulin aspart approved for IV use, which I just now told you that insulin aspart is suitable for IV use, just like regular human insulin, approved by European community and American community. Potential advantages: no switch in insulin formulation and therefore no loss of insulin. This is a very important one. So you don't have to switch in formulation means that sometimes what we used to do is that when you use the human insulin in other combinations, they can be used in different syringes and put them at a different level. And you have to shake them so they get an even mixture solution so before using it. But as it comes, the analog, they come in such a way that they are pre-mixed and they will not have to be shaken or anything. Patients with a high antibody levels may respond better and faster compared to the active. So that is again a very important thing, and it is in my life has happened so often that the juniors are very scared of using more than 10 milliliter per hour on insulin injection. 3, 4, 5, 6 is fine. Now when it goes to even when you're giving 10 milliliter per hour, even the sugar is got 300 and things, they are worried to go up. And this happens because you got insulin resistance. There it is much better than if you give an IV aspart, and then you will see that it comes down to around 7, 8 and they are getting control, where probably 12 index would be required. And there the chances of going up every hour you would have a rebound hypoglycemia, which is sometimes a problem. The requirement of doses may be less than the actoprid because of more absorption, and can safely be used in renal and hepatic impairment patients. There is no contraindication at all. The long-term use of insulin aspart and effect on cardiovascular mortality. You can see this is a trial which has been done. In durations, you can up to 4 or 5 years it's been shown, and you can see the very good difference that the 43% reductions compared to the regular human insulin and insulin aspart. And this trial came out in Diabetology in 2008, and this Ishimura is quite famous trial, and it shows the CV mortality has gone down. Again, this is not just the insulin, because it's the property of the insulin which gets your sugar control better and your hemoglobin A1C better. So you're getting a CV mortality which is better, and it depends more on a postprandial sugar check. Insulin aspart, short-acting insulin analog, approved in pregnancy by US FDA and EMA based on the RCD. And I had a little bit of confusion with my senior colleague in CMRI, a gynecologist who had admitted for a seizure with this patient, and we used a mixed drug,